Some 44,000 people will be diagnosed with thyroid cancer this year. Think about that for a minute, right? 44,000. According to the American Cancer Society, it's almost 3 times more common in women than men, and it's often diagnosed at a younger age than many other cancers. Dr. William Sumner is a surgical oncologist at Ascension St. Vincent's Riverside and is joining us this morning to talk more about this. Good morning. Thanks for being with us. Appreciate it.
Happy to be here.
All right, so what is thyroid cancer?
So all cancer really is unregulated growth of cells, and so in the thyroid, those cells start growing in an uncontrolled fashion when they shouldn't, and then can leave the thyroid and spread to other places.
And what is the thyroid, for our viewers who may not know? What does it do in our body?
It's basically your body's thermostat. So you turn the thyroid up, or the thyroid hormone up that it produces, all the processes in the body get revved up. Turn it down, everything slows down. So your hair grows faster if it's overactive, slower if not. Your heart is prone to palpitations if it's revved up. So basically all processes in the body speed up if it's overactive.
So are there any specific warning signs then that people would be aware of, you know, if there's maybe a problem with their thyroid that could be cancerous?
Well, so cancer in the thyroid usually doesn't cause those problems of overactive or underactive thyroid. Most of the time today, thyroid cancer is either caught based on your primary doing a physical exam and noticing a lump or nodule in the thyroid, also possibly just from a incidental finding on an imaging test that was done for some other reason, or then sometimes the patient noticing a lump or mass in the neck.
And where is that generally in the neck?
So you know, thyroid's right in the middle. Yeah. It kind of looks like a Honda symbol. So it's got an upper lobe on one side and a lower lobe on the other side, and then a little bridge in the middle. And then again, the thyroid cancer will often present as a nodule or mass in the thyroid. Some of those are benign. They're not all cancer. And so once that's either picked up, however it winds up being found, then it's a question of figuring out, is it a cancer or not?
And the importance also of not ignoring then
Sure.
something like that you might notice that you might pass off maybe as a bug bite or something else.
Right,
or is it typically bigger than that?
People will, it'll be bigger than that, and it'll be deeper, right? So that's one reason why it kind of has to enlarge before it gets noticed, either on physical exam or by the patient. And as it gets bigger, it can cause other symptoms. So there's a nerve that runs behind the thyroid that goes to your vocal cord. So if a big nodule is pushing on that nerve, it can cause a change in your voice where your voice becomes hoarse or raspy. It can push on the esophagus, which can cause painful swallowing or difficulty swallowing. And if a nodule starts to get really large, it can compress your airway, and so people will start feeling like they're short of breath. They can't get air in and out of their lungs.
I think that those are really important to tell the difference also, because you could see why people might ignore that and pass
Sure.
it off as, oh, I just have a sore throat. It's that time of year.
Reflux
I've got allergies.
or allergies, absolutely.
Yeah, right, exactly.
So.
We shared with the statistic from the American Cancer Society that more women than men. Is there a reason for that?
I don't know that we know why. It's true that it is more common in women than men. When it does happen in men, it often tends to be a little more aggressive than it is in women. So, it's a very treatable type of cancer, regardless, but a little more aggressive in men, even though it's less common in men.
And then often affects people at a younger age.
Can, yes,
yeah,
and
okay.
age at diagnosis also is important in terms of prognosis. But 30 to 50 or 55 or so is kind of which generally you think of a lot of other types of cancer as presenting later in life.
Later in life, yeah. But so then that's just, and maybe that's just because somebody has recognized the symptoms.
Or just that it happens in that age group more.
Yeah,
So.
Wow. Treatment options.
So, well, treatment-wise, usually surgery is involved. Most thyroid cancer is well-differentiated thyroid cancer, and that has very good outcomes and a very good prognosis. There are some other types that are a little bit more aggressive, and the prognosis isn't quite as good. Treatment usually involves taking out the part of the thyroid that has the cancer in it, and sometimes all of the thyroid. If there's any spread to the lymph nodes in the neck, you're usually also going to remove the lymph nodes on that side. And then the thyroid really needs iodine to do what it does to make the hormone that it makes. And so thyroid cancers also will uptake iodine. And so that gives us another option, that's usually used for a little bit more advanced thyroid cancers, spread to the neck, invasion into other structures where the risk of residual disease is higher. And we can give radioactive iodine, and that radioactive iodine acts as a Trojan horse, enters the thyroid cancer cells, and then radiates them from the inside out to destroy them.
Important, though, to catch it early, no doubt.
Yes.
Yeah, when it
So
comes to
better,
treatment,
better
as
if you
it is-
don't need that.
Right,
So.
yeah, better, and as is the case really with all cancers in terms of catching it early. Are there certain risk factors or lifestyle choices that people should avoid?
There's not that much of a role in lifestyle in thyroid cancer. There is definitely a risk factor in terms of patients who have had prior radiation to the neck for other reasons, increases your risk of thyroid cancer. And probably the other big one is a big family history of thyroid cancer. So if they're, in particular, medullary thyroid cancer, there's some genetic syndromes that go along with medullary thyroid cancer associated with another type of cancer called a pheochromocytoma. I say type of cancer. 10% of pheochromocytomas are malignant, the other 90% are not. But it's a relative. But if you have a family history for a pheochromocytoma, that's an adrenal gland tumor.
Have that conversation
then that can
with
be
your doctor for sure,
associated with thyroid cancer, with medullary.
Thank you for being here. We appreciate you.
No problem.